everybody. On Friday, we're bringing our Taking Action for Your Health campaign to a close. On this, week 8, our focus is on fertility and reproductive medicine. Take a look. Just a few minutes ago, we showed you Linda Hurtado's special report on why more and more women are freezing their eggs for use later in life. Also this week, Linda will be taking a look at fertility yoga, and she'll also show you the latest options available to patients dealing with infertility. The reports debut at 5 p.m. each night and are available for viewing anytime on our website. Joining us now in our studio, we want to welcome Dr. Sandy Goodman of the Reproductive Medicine Group, and also Jessica Bishop, who is a patient. And they are here to discuss the primary reason why many women deal with infertility. It's something that I was surprised to learn is the answer. Can you tell our viewers?
Yes, well, today we're going to be talking about polycystic ovarian syndrome, which is PCOS, and it's one of the leading causes of infertility.
What is that? How do you describe that?
Well, PCOS is the most common female hormone disorder affecting reproductive age women and adolescent girls. It occurs in about 10% of the population of women, which translates into about 5 million women in the United States.
Is there a certain age group that you're seeing, or does it affect women across the board?
Well, it can affect women across the board. We can see girls as young as 8 or 9 years old manifesting symptoms, and women who are in the menopausal part of their lives, but predominantly in the reproductive age group.
You said symptoms. What are some of the symptoms that patients who have this face? So many of them don't know they have it.
Yes, well, what's very alarming about this is that less than 50% of women who have PCOS are aware that they have the disorder. And the reason that that's particularly alarming is because it is the primary, or one of the primary causes of infertility, but is also, if left untreated, very common to have disorders such as diabetes, high blood pressure, cardiovascular or heart disease.
They lead to other serious
health conditions. Exactly.
What are some of the symptoms for a woman who's watching who may be having them?
Well, the vast majority of women who have polycystic ovarian syndrome have some type of abnormality in their menstrual cycles. So they may have cycles that are too close together, closer than 21 days apart, or too far apart, more than 35 days apart. Some women will skip cycles and then bleed for a month. And others will have no period at all.
Jessica, did you have any of these symptoms?
I did at the end. I started having them for a month or a cycle every other week. So I went into my doctor to find out what was going on, because it wasn't normal to me. Before I didn't ever have that. And
you told me that you and your husband have been trying to have a baby for about 3 years.
Yep.
But you were diagnosed how long ago?
In September of last year.
Just September of last year, diagnosed with the polycystic ovarian syndrome.
Yep, we went through all the testing, and that's what it came up with.
Wow. What's your message to women out there who are watching?
Just try to get tested. Go in if something's different. Track what's going on, because I didn't track for a long time because we weren't trying. So I could have found out years ago, but I didn't track anything. You should track from a young age on. Just because you're getting pregnant doesn't mean you want to track. You want to track just to know what's going on in your body.
So many times folks say, oh, you're just stressed, you're stressing over it, don't stress, and then you'll get pregnant. That's really not a good answer.
No.
Thank you, ladies, for coming in. We want to give you at home more information on a conference that the Reproductive Medicine Group is hosting. It's on May the 4th. It's from 8:30 in the morning to 3 p.m. at the Hilton West Shore Hotel. For detailed information on this conference, awareness is a very big part of what they do at the Reproductive Medicine Group. Please go online and visit them at tampafertilityconference.com.